The patient has only one IV site with a continuous infusion of lactated Ringer's solution. The provider has prescribed ceftriaxone 100 mg in normal saline 50 ml to be given IV now. What should be the nurse's first action? A. Mix the ceftriaxone into the normal saline and piggyback into the primary infusion. B. Insert a secondary IV so the infusions can run simultaneously. C. Stop the lactated Ringer's solution and start the ceftriaxone now. D. Check the IV compatibility of the two medications. Answer is D. Check the IV compatibility of the two medications. The nurse's first action after receiving the new IV medication order should be to check the Y-site compatibility of the two IV infusions. Depending upon the response, the nurse may need to start a new IV or run the medications into the same IV. In this case, the IV compatibility will show as incompatible for lactated Ringer's and ceftriaxone, so these medications should not be run on the same IV line. If possible, the continuous infusion should not be stopped unless an IV access is obtained, or the physician gives the order to pause the continuous infusion while the antibiotic is given. Which of the following lab tests would be considered point-of-care testing? A. Urinalysis. B. Sputum culture. C. Complete metabolic panel. D. Blood glucose. Answer is D. Blood glucose. A blood glucose would be considered a point-of-care test as the test can be completed at the bedside with the result given immediately. A urinalysis, sputum culture, or complete metabolic panel would not be considered point-of-care tests because these tests need to be run in a laboratory setting with specialized equipment not available at the bedside. The nurse enters the room of a patient complaining of lower back pain after a left hip replacement surgery. What non-pharmacological intervention would not be appropriate? A. Reposition the patient onto the left side. B. Massage the patient's back. C. Lower the head of the bed and elevate the patient's legs onto a pillow. D. Apply a warm pack to the patient's back. Answer is A. Reposition the patient onto the left side. If possible, the patient should not be repositioned onto the side where the hip surgery took place as this may cause decreased circulation or improper healing to the hip or cause more pain to the patient. The patient can be repositioned from supine to the right side. Massage is an appropriate method for nursing staff to use in decreasing pain for the patient. It is appropriate to lower the head of the bed to elongate the patient's back. The patient's legs may be elevated to prevent swelling and pressure ulcers. The application of heat to a painful area is appropriate. It would be acceptable for the nurse to obtain a doctor's order prior to heat application. The nurse notices a CNA using an alcohol-based hand sanitizer after walking out of a room marked as enteric contact precautions. What should the nurse's response be? A. Nothing, as the CNA has appropriately washed their hands after leaving the room. B. Tell the CNA they need to wear a mask in the room. C. Tell the CNA they should dispose of their gloves outside of the room. D. Tell the CNA they need to wash their hands with soap and water. Answer is D. Tell the CNA they need to wash their hands with soap and water. A room marked with enteric contact precautions indicates that normal alcohol-based hand sanitizer will not remove the bacteria present in the room. Hand washing with soap and water should be used instead of hand sanitizer. A mask is not indicated with enteric contact precautions. The CNA should dispose of gloves inside the room to contain the bacteria within the room, then hands should be washed with water and soap. A nurse is making a home health visit in a home of an elderly couple. The wife states regarding her husband, the patient, he always sits in that chair all day long. Which of the following should the nurse consider the patient at risk for? A. Pressure ulcer. B. Deep vein thrombosis. C. Constipation. D. All of the above. Answer is D. All of the above. The patient is at risk for all the listed conditions related to decreased mobility. Pressure ulcers form as the skin layers break down between the chair or bed surface and bone. This may happen due to the patient remaining in one position too long. This patient may be at risk for pressure ulcers to his sacrum or areas where his leg meets the footrest. Patients have been shown to be higher risk for deep vein thrombosis with decreased mobility. The patient should ambulate multiple times a day to lower his risk for DVT. Constipation is another common side effect of decreased mobility as the GI system slows. Which of the following statements to the type 2 diabetic patient by the nurse is correct? A. Eat less fruits and vegetables and more grains. B. Try to wear closed-toe shoes whenever ambulating. C. Minimize physical activity to prevent fatigue. D. Check your blood sugar only after meals. Answer is B. Try to wear closed-toe shoes whenever ambulating. The correct statement by the nurse is that the patient should wear closed-toe shoes when ambulating. Patients with diabetes are at high risk for impaired sensation in their lower extremities and may develop wounds that are difficult to heal. Patients with diabetes should be encouraged to eat more fruits and vegetables as part of a healthy blood sugar regulating diet. Increasing physical activity is another way the patient with diabetes can regulate blood sugar levels. If the diabetic patient is checking blood sugars, the levels would normally be checked prior to meals, typically to determine a dose of insulin. A patient is being discharged with a new diagnosis of congestive heart failure. Which of the following statements made by the patient indicate understanding of the diagnosis? A. I can drink as much fluid as I want. B. I should notify my doctor if my feet start to swell. C. Weight gain of 3 to 5 pounds in one day is to be expected. D. It is normally to have difficulty breathing at night. Answer is B. I should notify my doctor if my feet start to swell. The patient should notify the physician if edema starts developing in the lower extremities. This indicates more pressure on the heart and can cause complications. Patients with congestive heart failure need to have a limited fluid intake, typically around 2 liters per day to prevent fluid overloading. The patient should be aware this includes all types of fluids, not just water. Weight gain of 3 to 5 pounds in one day should be reported to the physician as this is a significant weight increase and may indicate fluid retention. The patient's medications may need to be adjusted. The patient complaining of difficulty breathing at night is experiencing pulmonary edema, a condition in which fluid builds up into the lungs. This symptom should be reported to the physician immediately. A nurse working in the telemetry unit receives a call that a patient's EKG rhythm has transitioned into atrial fibrillation. Which medication is the patient likely to receive long-term in relation to this diagnosis? A. Warfarin. B. Heparin. C. Furosemide. D. Albuterol. Answer is A. Warfarin. Warfarin is a common medication given long-term in the management of atrial fibrillation to prevent the development of blood clot, or thromboses, that can cause blockages in the heart or lungs. Heparin, while used to prevent thrombosis in atrial fibrillation, is not usually administered long-term as it is an IV or subcutaneous injection. Furosemide is given as a diuretic in decreasing fluid retention. It is normally given to patients with congestive heart failure. Albuterol is typically a drug that is inhaled in the treatment of chronic obstructive pulmonary medication or asthma as a rescue medication. It is contraindicated in atrial fibrillation. A patient has incentive spirometry ordered 10 breaths 4 times a day after a cholecystectomy. The patient is asking why they need to perform this action. Which of the following would not be a reason the patient should use the incentive spirometer? A. To decrease lung capacity. B. To gently exercise the lungs. C. To improve recovery time. D. To prevent pneumonia. Answer is A. To decrease lung capacity. Using an incentive spirometer will increase lung capacity, opening the bronchioles, and allowing for better oxygenation throughout the body. Using an incentive spirometer gently exercises the lungs and will encourage the patient to take long and deep breaths instead of short and shallow breaths, which are common following surgery. Maintaining adequately expanded lungs and allow better oxygenation through the bloodstream will improve recovery times, allowing for the patient to start ambulating sooner as well as encourage proper healing to the surgical site. Incentive spirometry use prevents pneumonia by keeping bronchioles open and clear, minimizing the sustainable environment for pneumonia to develop. A nurse is changing the dressing for a post-op bilateral knee amputation patient. The nurse notes the patient refuses to look at the limb while the dressing is being changed but asks the nurse about their personal life instead. Which nursing care plan should the nurse implement for the patient related to this action? A. Disturbed body image. B. Altered sleep pattern. C. Impaired memory. D. Impaired social interaction. Answer is A. Disturbed body image. A patient with loss of limb may be experiencing disturbed body image. The nurse should be sensitive to the patient's emotional and mental acceptance of the loss and incorporate therapeutic communication as the patient allows. Acceptance may take time and the patient should not be pressured into looking at the limb. The patient may be experiencing altered sleep patterns related to the surgery, however the patient refusing to look at the limb indicates disturbed body image. The patient remembers the limb is there and is refusing to look at it, therefore impaired memory does not appear to be the issue. The patient does not appear to have any issues communicating with the nurse, so the patient is more likely experiencing disturbed body image related to the loss of the limb rather than impaired social interaction. Which method should be the last resort in assisting a patient who is experiencing mild anxiety? A. Therapeutic communication. B. Deep breathing. C. Progressive muscle relaxation. D. Administration of Haldol. Answer is D. Administration of Haldol. Non-pharmacological methods should be used prior to pharmacological methods. Haldol is normally given to patients experiencing severe anxiety or agitation and should be used as a last resort. A patient may benefit from the nurse sitting with them and providing calm conversation over the anxiety-causing issue. Deep breathing is a well-known calming technique used to calm the nervous system and can help in cases of anxiety or panic attacks. Progressive muscle relaxation can be used to encourage the patient into a more relaxed state. The nurse can assist the patient to lay on the bed and provide instructions to the patient in a slow, calm voice. Progressive muscle relaxation would be helpful for mild anxiety. In which of the following ways can the nurse promote the sense of taste for an older adult? A. Mix foods together on the dinner tray. B. Avoid cologne, air fresheners, or room deodorizers. C. Encourage the client to chew food thoroughly. D. Discourage the use of salt or seasonings with prepared food. The answer is C. Encourage the client to chew food thoroughly. As clients age, their sense of taste may diminish, reducing the joy that comes with eating. A nurse can promote the sense of taste for a client by encouraging him to chew his food thoroughly while eating. This results in longer contact of food with the taste buds and a greater chance of tasting the food. Which of the following is classified as a prerenal condition that affects urinary elimination? A. Nephrotoxic medications. B. Pericardial tamponade. C. Neurogenic bladder. D. Polycystic kidney disease. The answer is B. Pericardial tamponade. A prerenal condition is that which causes reduced urinary elimination due to a diminished blood flow to the kidneys. A condition such as cardiac tamponade affects the heart's ability to pump adequate amounts of blood, thereby reducing blood flow to vital organs throughout the body, including the kidneys. A nurse is assessing an African American client for risks of a pressure ulcer. Which of the following best describes what the nurse might find with an early pressure ulcer in this client? A. Skin has a purple, bluish color. B. Capillary refill is 1 second. C. Skin appears blanched at the pressure site. D. Tinting appears when checking skin turgor. The answer is A. Skin has a purple, bluish color. When assessing for signs of developing pressure ulcers in a client with dark skin, decreased circulation may not always be readily apparent. For instance, blanching, the red undertones seen in light-skinned clients, will not always be present. Instead, the skin of an early pressure ulcer may develop a purple or bluish color. At the beginning of the shift, a nurse receives report for her daily assignment. Which of the following situations should the nurse give first priority? A. A diabetic client with a blood glucose level of 195 mg per deciliter. B. A family member of an elderly client who has questions. C. A client with COPD with an oxygen saturation of 84%. D. A client who requires assistance to use the bathroom. The answer is C. A client with COPD with an oxygen saturation of 84%. When prioritizing needs of clients, the nurse must begin with the unstable client or manage conditions that affect airway, breathing, or circulation first. The client with COPD has a condition that affects breathing and is exhibiting decreased oxygen saturation levels, therefore, this client should be the first priority. Mr. W has orders for a physical therapy consult. The nurse contacts the appropriate department, but 12 hours later, no one has come to see the client. Which is the most appropriate action of the nurse? A. Call the supervisor and file a complaint against the physical therapy department. B. Contact the physician to notify him that the orders were not carried out. C. Assess the client's activity level by assisting with ambulation using a gait belt. D. Contact the physical therapy department again and repeat the order. The answer is D. Contact the physical therapy department again and repeat the order. Nurses must typically work as part of a larger interdisciplinary team that involves collaboration with other professionals. In order to fulfill the client's needs, communication between disciplines should remain respectful, with clear directions about each discipline's responsibilities. Communication between all parties minimizes confusion about the client's care. Mr. W has orders for a physical therapy consult. The nurse contacts the appropriate department, but 12 hours later, no one has come to see the client. Which is the most appropriate action of the nurse? A. Call the supervisor and file a complaint against the physical therapy department. B. Contact the physician to notify him that the orders were not carried out. C. Assess the client's activity level by assisting with ambulation using a gait belt. D. Contact the physical therapy department again and repeat the order. The answer is D. Contact the physical therapy department again and repeat the order. Nurses must typically work as part of a larger interdisciplinary team that involves collaboration with other professionals. In order to fulfill the client's needs, Communication between disciplines should remain respectful, with clear directions about each discipline's responsibilities. Communication between all parties minimizes confusion about the client's care. The B in the SBAR acronym stands for A. Background. B. Basic. C. Beginning. D. Break. The answer is A. Background. The B in the SBAR acronym stands for background. The SBAR is a communication tool used between providers that regulates the type and amount of information given. When contacting a physician, the nurse provides information about the situation, the client's background, the nurse's assessment, and further recommendations. Which of the following nursing interventions is appropriate for a client who is suffering from a fever? A. Avoid giving the client food. B. Increase the client's fluid volume. C. Provide oxygen. D. All of the above. E. Both B and C. The answer is E. Both B and C. Interventions for a client who is suffering from a fever include increasing the client's volume of fluid and providing oxygen. A fever increases the body's metabolism, causing the client to breathe at a faster rate and increasing the work of the heart. The client is at risk of fluid loss due to increased respiration and sweating. The increased work of the heart requires more oxygen to maintain perfusion to the tissues. A client has started sweating profusely due to intense heat. His overall fluid volume is low and he has developed electrolyte imbalance. This client is most likely suffering from A. Malignant hypothermia. B. Heat exhaustion. C. Heat stroke. D. Heat cramps. The answer is B. Heat exhaustion. Heat exhaustion occurs when a person has enough diaphoresis that he becomes dehydrated. Intense sweating can cause both fluid and electrolyte imbalances. Untreated heat exhaustion can lead to heat stroke, which results in organ damage, loss of consciousness, or death. A nurse is attempting to assess a client's pulse in his foot. She palpates the pulse on the anterior aspect of his ankle, below the lower end of the medial malleolus. Which type of pulse is this nurse taking? A. Dorsalis pedis. B. Popliteal. C. Posterior tibial. D. Femoral. The answer is C. Posterior tibial. The nurse can palpate the posterior tibial pulse to assess circulation to the foot and ankle. The posterior tibial pulse is felt by palpating the inner side of the ankle, behind the medial malleolus. Mrs. J is in the adult ICU on a ventilator. The nurse caring for her recognizes that her endotracheal tube needs suctioning. Based on the nurse's understanding of this procedure, what level of pressure should the nurse apply while suctioning? A. 70 to 80 millimeters of mercury. B. 100 to 120 millimeters of mercury. C. 150 to 170 millimeters of mercury. D. 200 millimeters of mercury. The answer is B. 100 to 120 millimeters of mercury. When suctioning the endotracheal tube of an adult client, the nurse should set the suction apparatus at a level no higher than 150 millimeters of mercury, with a preferable level between 100 and 120 millimeters of mercury. Suction pressure that is too high can contribute to the client's hypoxia. Alternatively, too low of suction pressure may not clear adequate amounts of secretions. The nurse caring for Mrs. J is prepared to suction her endotracheal tube. Which of the following interventions will reduce hypoxia during this procedure? A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. B. Administer 15 cc of sterile fluid into the tube prior to suctioning. C. Suction for no longer than 30 seconds at a time. D. Wait 30 seconds after suctioning before attempting again. The answer is A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. Before suctioning a client's endotracheal tube, the nurse should provide extra oxygen for approximately 30 to 60 seconds. Hyperoxygenating a client before suctioning increases oxygen delivery to the tissues and reduces hypoxia that may develop during the procedure. Which of the following conditions is a contraindication for performing a diagnostic peritoneal lavage? A. A client who is 9 weeks pregnant. B. A client with a femur fracture. C. A morbidly obese client. D. A client with hypertension. The answer is C. A morbidly obese client. Diagnostic peritoneal lavage is contraindicated in clients who are morbidly obese because excess body fat makes finding essential landmarks for this procedure difficult. Additionally, the equipment used for the procedure may not be large enough to accommodate an obese person. Finally, morbid obesity puts excess strain on the cardiovascular and respiratory systems, such that anesthetic agents used during the procedure could cause further complications. Which of the following is an example of client handling equipment? A. Wheelchair. B. Height adjustable bed. C. Shower chair. D. Call light. The answer is B. Height adjustable bed. Client handling equipment is designed to reduce the stress and workload on nurses who must assist, turn, or lift clients. This equipment decreases the risk of injuries associated with improper lifting. A height adjustable bed raises the client up to a proper working height for the nurse who must provide assistance. Which practice will help to reduce the risk of a needle stick injury? A. Only expose the end of the needle once ready to enter the room for the procedure. B. Always place the cap back on a needle after it has been used. C. Keep a sharps container nearby where it can be easily accessed. D. Pass needles between nurses by using the handover technique. The answer is C. Keep a sharps container nearby where it can be easily accessed. When administering an injection or using sharps for a procedure, the nurse can minimize safety risks by keeping a sharps container nearby. This provides easy access for quick disposal to prevent the possibility of a needle stick. Needles should never be recapped after use, and nurses should always exchange needles from a central area rather than passing them between workers.